Okay, thank you, Tricia and Ashara. It's my pleasure to be here tonight. I'm going to talk to you over the next 45 minutes or so about gastroesophageal reflux disease and heartburn, and also some of the sort of long-term effects that having that can have in terms of complications. And particularly, I'm going to spend a little bit of time talking about a condition called Barrett's esophagus. Okay, so just out of curiosity, how many of you ever heard of the word Barrett's esophagus? Okay, all right, so most of you have heard of it. So we're going to talk a little bit about that. So I'm going to sort of spend about 30 minutes maybe talking about reflux and maybe about 15 minutes about Barrett's. Okay, and then we'll have some time for questions at the end. Okay, so the first thing is heartburn is a symptom. So, it's not really a disease. Heartburn is just what you feel. It feels like the center of your chest is on fire. That's where your heart was. So that's basically where they say, well, it's heartburn. Okay, but it's actually not the condition. And there are other things that can give you those exact sort of symptoms. Okay, so GERD is actually the condition. Well, what is GERD? GERD is gastroesophageal reflux disease. Okay, and that's what GERD. And that's really a condition where you have contents from the stomach coming back up into the food pipe, which is the esophagus that connects the mouth to the stomach. And that can cause a variety of symptoms, sometimes discomfort, it can cause pain, and it can cause a sense of just a feeling of a bad taste in your mouth, and actually it can cause a variety of other things, which I'll talk to. So heartburn is a symptom, GERD is actually a medical condition. So there's really sort of a couple of different kinds of spectrums of this sort of condition of GERD. You could be like the gentleman on the left who really complains of heartburn occasionally, just once or twice a month, intermittently, maybe associated with some dietary indiscretions, and we'll talk about what they are. So in his case, it's carbonated beverages and maybe somewhat of a little bit of a greasier meal. Okay. And he gets relief with just over-the-counter stuff like Tums or Rolaids or those kinds of things that you'd see, so antacids. And then the person on the left has a little bit more serious version. It's not just once or twice a month, it's every day. And gets relief with over-the-counter medications, and pretty much every class of medication now, for the most part, is over-the-counter. There's a couple that there aren't, but most of the medications that we use to treat acid are actually available without a doctor's prescription now. He's had symptoms for a much longer period of time, and it's becoming more frequent. And so we'll talk about sort of the difference in spectrum between those two people and what it means. So it's a common condition. Basically, 1 out of 2 people in this country is going to have these symptoms of GERD, okay, once a month. So it's really a huge problem, okay, and I'll get to just how big in a minute. And 1 in 5, or 20%, has symptoms at least once a week, okay? And this actually, their studies have shown, can cost, based on lack of productivity, lost days due to work, a variety of other things. It has a significant impact, about $3,000 per employee annually, and it's not really the cost of the medications, it's actually the cost of how this impacts your life and your productivity, okay? So one thing before I start, because one of the talk is it heartburn or something else, right? So I would always mention that if you're having chest pain, particularly if you have symptoms that go to your arm, particularly your left arm more than your right, up into your neck or into your jaw, a burning in your throat that's severe, that isn't relieved by sort of the medications that we're going to talk about, symptoms particularly if they get worse when you exercise, if you're associated with a lot of shortness of breath or fatigue, those are all very concerning signs for it actually being your heart. And certainly if you're having this, usually the most important thing initially is to make sure that it's not that. So if you're having any of these types of symptoms as well, along with what you think is GERD, I would certainly tell your primary care doctor and have you see a cardiologist or a heart doctor to discuss whether additional testing is needed. Okay, so that's very important. Okay, so hopefully you're not having those symptoms, and so we'll assume that you have something that we think is likely to be GERD or heartburn symptoms. And so we'll talk a little bit about how common it is, how does it feel, why do we get it, and again, I've sort of gone over that a little bit. Monthly, I said it's, again,